back with me on the Mom Edition. So, delivery is one of the times in our lives that brings a lot of anxiety, a lot of excitement because we are going to meet our new baby, and a lot of fear too. Because during labor and delivery, we have to make so many decisions. We not having any medical background, we are generally so confused about what to do, what not to do. Doctors suggest some things, nurses suggest some things. We have overheard few things from our friends, from their experience. So it is very confusing to how to proceed with certain decisions. So in order to have a positive birth experience, whether you decide to have a C-section or a normal delivery or some kind of medicated birth, if you are making informed, empowered decisions, there are chances that you will not regret it later on. So today I'm going to discuss a form of medicated birth with the help of epidural, which is a pain management technique. So I had taken an epidural during the birth of my daughter, and I would say from personal experience that it was the best decision of my life, because if it was not for epidural, I would have ended up having a C-section, which I wanted to avoid. I had discussed the option of epidural with my doctor well in advance. I had done my research on it, what are the advantages, what are the disadvantages. So when it was time for me to say yes or no to the epidural, I was ready with my decision. And I would like to give the information that I learned during my research, so that even you can take an informed decision. Whether a yes or a no is a completely personal choice. Painless labor basically refers to methods that can be used to reduce or eliminate your labor pain. So as we know, labor is very painful and we opt for certain methods to handle the labor. It might not be 100% gone, but a relief in the pain or a reduction in the pain is always welcome. So that can be done using medications like epidural, or that can also be done through non-medical ways like breathing exercises, massage techniques, etc. So for me, none of these techniques worked. I had seen so many breathing techniques videos and all the positions that I should be doing while in labor and all that, and I tried my best to just handle my labor pain using natural ways, but unfortunately that didn't work for me, so I had to go for the medicated option. And also remember that opting for a painless labor does not mean that you will have no discomfort at all. You will feel all the pressure, and you will have to reach a point in your labor where epidural can be administered. So there will be certain amount of pain that you have to endure in order to reach that point where epidural can be administered. So now, what is an epidural? Epidural basically is a regional anesthesia which numbs the lower part of your body, and it blocks the signals from the lower part of the body to the brain. The body is enduring pain, but our mind is not capturing that sensation. The signals are blocked. So you don't have to worry about not feeling anything, because I assure you, you can feel all the pressure with every contraction, and even during the pushing stage you will feel everything, but the pain associated with the contractions is reduced to a great extent. So let me just in short tell you what is the procedure of epidural. So basically, according to my research, you have to have your cervix open up to certain centimeters for your doctor to say yes, that this is the time you can have an epidural. I think it is 5 centimeters of the total 10 centimeters. So after you reach halfway, only then can you have an epidural. But I think this also depends from one doctor to the other. So discuss with your doctor about what is the norms in your hospital. Procedure wise, They will make you sit or lie down, and your back will be arched like this, like you will be taking support and arch to your back, and then they will give you a anesthesia injection in your back. Once this small area is numb, a small needle will be inserted in your epidural space. So now what is an epidural space? So your spine has spinal cords. So between two cords there is a specific epidural space. I mean, I am not a doctor, so I don't know the medical terms for that. So when you arc your back like this, the space opens up and the doctor can insert the needle from there. So the needle is inserted, and through that small needle a catheter, or you can say a very small tube, is inserted which goes into the epidural space. Then they remove this needle and that tube is still in your spine. So once the catheter is in the place, all the drugs are administered through this tube. It's not that at one go all the medicine is pumped. No, the medicine, the pain relief medication is put into your spine in regular intervals according to how much pain you are experiencing. Depending on that, they will adjust the dose of how much medication you will get. Now let's come to the main point of what are the pros and cons of using an epidural as a pain relief management technique. So first of all, let's talk about the benefits. The first obvious benefit is the pain relief. As I said, for me, my pain was 100 and it dropped to 5% in matter of 10 minutes, and I would say that is one major benefit. So that allows the mother to feel more relaxed and more comfortable, which in return gives us a sense of control. Because if you are in so much pain, your head stops working, you cannot think, you feel completely out of control. So by having epidural, you get that sense of control back. Another main positive point is epidural is proved completely safe for the baby too. So obviously we wouldn't want something that is harmful to the baby to be given to us only because we want our pain to decrease. So no, epidural medications are completely safe for the baby too. That is a second major benefit. Third benefit is that if you are more rested, if you are more comfortable, then you have more energy saved for your delivery. So when it is time to push, you are more energetic and you can give all your might into pushing the baby out. Because as we know, for when the labor is very long, the mothers become so tired at the end of it that they have no energy left to push. So with epidural, even if your labor becomes a little bit longer, you will have that energy reserved for your pushing stage. Another major benefit is that if there is an emergency C-section that needs to be done, so when the epidural apparatus is already in place, giving the anesthesia required for C-section becomes easier. And if C-section is really time sensitive, doctors can quickly carry on the procedure and do the needful. Because otherwise, if the C-section is an emergency, the doctor might just give you a general anesthesia and you will be unconscious for the entire procedure. And we mothers, we want to see our baby being born into this world at that very moment. So being completely unconscious might not be preferable. So having epidural in space makes sure that even if you have a C-section, you are good to go. Now let's talk about the risks associated with epidural. Major risk associated with epidural is that epidural causes mother's blood pressure to drop, which is obviously not good for the mother and for the baby. So if not treated appropriately, that could be dangerous. Second drawback is that with epidural, there will be continuous fetal monitoring. So there will be straps put on your belly which would continuously monitor fetal heart rate. So having these straps around is also kind of uncomfortable. This brings me to the third disadvantage, that with epidural, you lose sensation in lower part of your body. So you are kind of bound to bed. You will not be able to move around a lot. So as we know, moving around, walking, coming in certain postures and positions helps with labor. So when you're restricted and bound to bed, labor might slow down and there might be extra time you have to be in labor. And because the labor slows down, there might be some external medications that need to be given to promote the labor to go faster, like pitocins. I was given medications to help my labor progress. So now with epidural, you are on a countdown. Now there is only certain amount of time that epidural can be given. So the doctors have to make sure that you deliver within that time frame. So in order to make you deliver within that time frame, you might be given external medications to increase the contractions. You will not feel them, but yeah, you will have to pump in more medication into your body. So that is one disadvantage. But that is only if you are not progressing in your labor fast enough. For certain women, they have an epidural and within half an hour they are already deliver. So for them, obviously, they will not give external medications to improve contractions. So the doctors will have to decide whether you need pitocins and other drugs or not to help you increase your labor contraction. Another thing is epidurals might give some women headache too, so be ready for that as well. With epidurals, backaches for first few months are common. Actually, I think it is a myth that having an epidural or having an injection put in your back gives you backache. So backaches are pretty common for all types of birth. So I don't think epidural should be blamed for our backaches. The next point is that, as I mentioned earlier, every woman's body reacts differently to the anesthesia. So for some women it might not be 100% effective, but obviously certain amount of pain reduction can be achieved with the use of epidural. Another major drawback that I had is during my recovery, I was dizzy for 2 complete days. I could not get up from my bed. I was so dizzy because I didn't eat anything. I also had like a painful first half of labor and a longer second half of labor. So I was very tired, obviously. So I don't know what was the reason exactly. Was it the epidural or was it just the fact that I was tired? But I was very dizzy for the first couple of days after the birth of my daughter. So dizziness is one drawback that is very common. And for me, that was there. I did not have any headache. I also vomited after I finished my labor and after I delivered my baby girl. Again, I think that all these drugs on an empty stomach triggers that vomiting sensation and nausea. So I definitely had that with my epidural experience. And also when you have an epidural, you have all these IVs connected to your hand, so and they will keep it for at least a day for any emergency. So that IVs are really troublesome because you can't even hold your baby properly, and it just comes in between every time you get up or try to hold something, or even when you try to feed your baby. So IV needle is really irritating, especially if you are a new mother. The question is now, how do you decide whether to go for an epidural or not? So it is a very personal choice, as I mentioned earlier. It depends on many things actually. Obviously your personal choice, and second is, how is your labor progressing? It might be the case that you are already so far ahead in your labor that having an epidural would not make any sense. You are anyways going to deliver in half an hour. So rather than taking all the risks associated with epidural, you just wait for half an hour and you'll be done. So that is again your doctor's advice, which is important. Second thing is, how is your pain tolerance? If you are a person who cannot tolerate any amount of pain, maybe epidural is for you. So that is again, you have to ask yourself, can I tolerate that level of pain or not? The most important thing is communicating with your healthcare provider, being in touch with your doctor throughout the delivery procedure, because your doctor would be the best man who can tell you, or women who can tell you whether epidural would be a good choice or not, but having all the information about it will empower you to ask the right questions to your doctor. So let me end this video by telling you that ultimately it is your decision, and depending on the situation that you are in your labor at that given point of time, according to your doctor's advice, you can decide whether you want to go for an epidural or not. For me personally, it was definitely a good decision, and if somebody asks me, I would say yes, go for it. So I would like to wish you good luck on having a wonderful delivery and birth experience, and good luck on your journey of being a mother. Bye, see you soon.